Hi, I'm Dr. Christopher Zoumalan, a board-certified oculoplastic surgeon and also the creator of the natural-looking blepharoplasty technique.
It's been an incredible year. We had beautiful transformations, a few surgical puzzles to solve, plenty of laughs with the team, and most importantly, patients who trusted us with their eyes, the most expressive part of the face. So today, I want to look back at some of the moments and transformations that made 2025 unforgettable. One patient came in with a simple wish. I want to wake up just looking like myself, just rested. She had significant brow heaviness, upper lid skin redundancy, and lower lid creasing and fat pockets that made her look tired even on her best days. So we performed an endoscopic brow lift, upper lid blepharoplasty with nasal fat pad removal, lower lid blepharoplasty with fat repositioning, and a beautiful CO2 laser to improve the skin texture of her lower lids. At 1 week, she couldn't believe her recovery. Swelling was already down, bruising was minimal, and she even said, "I feel as good as I look." But by 3 months, her results were seamless. The brow sat beautifully naturally, upper lids were just beautifully rejuvenated, the lower lids were smoother, and the CO2 laser gave her that refined, bright look. A beautiful case, and honestly, a joy of a patient. Another transformation that stood out this year was a complex lower eyelid case. This patient had significant fat prolapse, extra skin, lower lid laxity, and some brow asymmetry. So we combined lower lid fat repositioning through an internal approach, along with a skin pinch, a canthoplasty to help tighten the eyelid because there was so much laxity in the lateral canthal area, and a focal direct brow lift on his left side to help restore some balance when it came to the brow asymmetry as well. It was one of those cases where every millimeter matters. At 1 week, he already looked pretty good, almost incredible in fact. Smooth contour, balanced brows, swelling exactly where it should be. And by the following few weeks, the reconstruction started to settle in beautifully. This case really highlighted why precision and cautious restraint are so important in lower eyelid surgery. One of my favorite transformations this year was a patient who underwent what I call the Bella lift, an endoscopic brow lift, quad blepharoplasty, fat repositioning, and a CO2 laser resurfacing. The goal? Opening her eyes, softening the lower lid transition, and refreshing the overall expression while keeping everything natural. A week after her surgery, her healing was unbelievable. Clean incisions, smooth contour, and she said she couldn't believe the difference already. And at 4 months, her results were elegant and balanced. She told us she felt more confident than she had in years, and that's exactly why we do what we do. This year reminded me of a simple truth. The best results aren't about dramatic change. They're about restoring light, balance, and confidence. Every patient's anatomy is different. Every motivation to having a procedure is different. But the joy of seeing somebody to recognize their own reflection again, that never gets old. And to every patient who trusted us this year, thank you. To my team, thank you. And to everyone watching, learning, and planning your own journey, we can't wait to guide you into 2026 with clarity, artistry, and natural results.